down to the different components of those structures. So your lymph nodes is divided into two main parts. Okay, the cortex and the medulla. Okay, so if you look at this diagram here, okay, so all of this is your cortex out here, and this is your medulla of the lymph node. Same, the spleen also has the cortex and medulla. We'll look at that shortly. All right. So now within the cortex, okay, you have, it's also subdivided into other structures. You have the paracortex, all right, and then the lymphoid follicles, okay, and then your lymphoid follicles are further divided into primary follicles, secondary follicles, all right. So where are the lymphoid follicles? There are these round structures you can see here within the cortex. So what's different between the primary and the secondary follicles? The secondary follicles is dense, while the primary follicle is dense, and then the secondary follicle has a pale center, as you can see here. So you can imagine the secondary follicle like a hard-boiled egg that you cut into two. Okay, the yolk is the yellow part, and then it's surrounded by the white. So you can imagine that like the secondary follicle. Okay, and so the secondary follicle has a pale center, is bigger than the 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 primary follicle, right? And then where's the paracortex? The paracortex is this blue region, pale blue region that surrounds the follicles, right? Now this is very important. I'm taking my time to explain all of this because it's very important. You could get questions that will ask you all these different locations, okay, and what cells are found in those locations and what disease process can affect those locations, okay. Then your medulla has 2 points, also divided into points. It has the medullary cords and the medullary sinuses. Okay. So your medullary cords have lymphocytes, plasma cells, your medullary cords. So like now, if we before I move on to the specific kind of cells that are in there, this micrograph you can see here is just a cut section of your lymph node, right? So the outer layer is coming from the outside. So this is your capsule over here. Okay, this is your capsule out here. So you're coming from outside in, from your left towards the right. Moving from left to right, you're going from outside the lymph node to the inside. Okay, so this is the capsule, all right? And then, let me use a different color. Then this is so this will be your cortex. This will be the medulla here. Okay, this will be your lymphoid follicles here. You can see they have a pale center, so they are the secondary lymphoid follicles, right? And surrounding them is the paracortex, right? So why are these distinctions important? So your T cells are found, T cells localized to the paracortex, your B cells in the lymphoid follicles, all right? Then you have your T and B cells, they move down from the cortex into the medulla and they go down to the cords before they leave. All right. So one thing you can see here is the lymph node has multiple efferents. Okay. So if you look at this and then one efferent. So if you imagine your lymph node as the battle station, just to see there are many roads leading into that battle station. And why is that so? It's so that I can filter as much lymph as possible. All right. And then one exit point so that all the lymph comes in and leaves only through one point. So the lymph node is able to filter as much lymph as possible. Okay. So your your T and B cells move from the cortex towards the medulla and out of the lymph node through the efferents. All right. So in the medulla, your B and T cells will be in the cords. Then the sinuses are unique. That's where you have your macrophages. So all these cells we're talking about, we'll describe them in detail in our next lecture. Okay. So your lymph node from the structure, it has the cortex, the medulla, The cortex is divided into the paracortex, the lymphoid follicles. The medulla is divided into the cords and the sinuses. Okay. The paracortex is where your T cells are located. Lymphoid follicles are where your B cells are located. The sinus, medullary sinuses are where your macrophages are located, more importantly. Okay. The lymphoid follicles are further divided into primary and secondary lymphoid follicles. Okay. So now that we've described that, let's move on. Okay. So now coming to the notes here. All right. So we said it's a secondary lymphoid organ with many efferents and one or more efferents. So more efferents, more vessels, lymphatic vessels going in, and then one or if you leaving the lymph node. It's encapsulated with the trabeculae, okay, and then functions as non-specific filtration by macrophages, with circulation of B and T cells, and is involved with immune response activation. So that's where the B and T lymph nodes will be where the B and T cells will go to interact with an antigen. Right. So you have three main cells in the lymph node: T cell, B cell, and the macrophages. Okay. So the follicle, like I said, it's in the outer cortex, right? In the outer cortex, and it's the site of B cell localization and proliferation. So the primary follicles are dense. Secondary follicles have a pale germinal center and are active. All right. So why is this point important? Why is first aid mentioning this? Okay. So if you have a bacterial infection, a bacterial infection, the bacterial antigens will travel to the lymph node and will specifically activate the B cells, more especially. Okay. To specifically activate the B cells. And then when those B cells in the follicles, particularly when they become activated, they form the secondary lymphoid follicle, the pale germinal center. So in the presence of bacterial infection, you have the lymph node become enlarged. That's a lymphadenopathy. Okay, it becomes bigger, more primary and more secondary follicles will be formed. So it's important for you to know that, because if you get a question where they're talking about pulse and they say lymph nodes enlarged, so and which area of the lymph node will be involved, you know that okay, it's the lymph node, the secondary follicles in the cortex, because the B cells will be proliferating, expanding in numbers to take care of that infection. All right, the B cells will be expanding in number to handle that infection. All right, so all right, so that's for the B cell. And then if there are other conditions where you have the lymphoid follicles will be reduced in number and size. Okay, they'll be pale, or you won't find any secondary lymphoid follicles. So we'll come to those conditions that affect B cell development and maturation. So the B cells will not. So that's two conditions. You have lymphadenopathy, okay, where you have bacterial infection, and then expansion of the secondary lymphoid follicles. Okay, and then the other condition where you have low B cell numbers, so the secondary lymphoid follicles will be reduced in number. And therefore, if you look at the lymph node, it will be shrunken with absent lymphoid follicle, the absent germinal centers. All right, so this term, germinal center, is what is in the middle of these secondary lymphoid follicles. That's what we call germinal center, the pale centers of the secondary lymphoid follicles. All right, so moving on, I'll move to the paracortex because we're still in the cortex before I go to the medulla. All right. So for the paracortex, say it contains the T cell. All right. So it's the region of the cortex between the follicles and the medulla. Right. Contains high endothelial venues in which the B and T cells enter the blood. So the T cells will move between the follicles into those venues towards the medulla and into the efferent lymphatic vessels. So underdeveloped, very important in patients with DiGeorge syndrome. Okay, so DiGeorge syndrome will come across in future sessions, but for now, what I'll just say is it's composed. It's a disorder that affects the development of the third pharyngeal pouch. okay, third and fourth pharyngeal pouch. And one of the organs that develops from that third and fourth pharyngeal pouch embryologically, third and fourth pharyngeal pouch, is the thymus and the parathyroid glands. Okay, the parathyroid gland. So we mentioned earlier that the thymus is very important for T cell development. So if anything knocks out the thymus, that means your T cells don't get to mature and develop. So they will never get to the peripheral secondary lymphoid organs. That's they will not go to the cortex. So your cortex will not be developed and your lymph node will also be shrunken, right? So that's the most important thing I'll say about the judge. So those few patients will also be predisposed to recurrent infections, okay, particularly viral, fungal infections, right? So no T cell development in the absence of a thymus, which occurs in the George syndrome because there's impaired development of the third and the fourth pharyngeal pouches. All right. So, and final point about the paracortex, it enlarges in extreme cellular immune response to viral infections. Okay, that's Epstein-Barr virus and other viral infections, which lead to paracortical hyperplasia. So paracortical hyperplasia just means the paracortex will expand and push the lymphoid follicles apart. So the lymph node will also be enlarged, but when you look at it, the lymphoid follicles will be much further apart from each other, right? And that will lead to when you hear lymphadenopathy, that's either the lymph node is very big or very small, but both cases are abnormal. So we said lymphoid follicles, B cells, more of bacterial infection will lead to expansion, increased number of those follicles, formation of multiple germinal centers, right? For T cell, viral infection will cause paracortical hyperplasia, all right? Paracortical hyperplasia. Okay. So now moving on to the medulla, right? So it consists of the medullary cords, which has the lymphocytes and the plasma cell, and then the medullary sinuses, which contains reticular cells and most importantly the macrophages. So the medullary sinuses communicate to the efferent. So from the medullary sinus, all the immune cells can exit the lymph nodes via the efferents. Okay, so let me go over everything we've said in this page before we move on, because from here I'll open up the floor for your questions, and then we'll move on to have a short test to see if you guys have been following what I'm saying. Okay, so we said the primary lymphoid organs. So we said the primary lymphoid organs are the primary lymphoid organs are the bone marrow and the thymus. So the bone marrow produces both B and T cells, right? And the T cells remain behind. The B cells remain behind, mature in the bone marrow, while the T cells exit, go to the thymus to complete their development and maturations. All right. We have the secondary lymphoid organs, which is where the B and T cells will interact with the foreign antigens, like the battle stations where your troops will be deployed to encounter fight against foreign invaders. Okay. So the level of the secondary lymphoid organs, spleen, lymph node, adenoids, Peyer's patches, tonsils. But for now, for step one, spleen and lymph node. Okay, so we moved on to the spleen. The lymph node. The lymph node is bean shaped, has many efferents coming in, one efferent. It's encapsulated. It's divided into two main portions: the cortex and the medulla. Okay, within the cortex, you have the paracortex, where the T cells are located, and you have the lymphoid follicles where your B cells are located. Lymphoid follicles are divided into two more parts. You have your primary follicle, which is dense, small and dense. Secondary lymphoid follicle, which is large with a pale center like a ball egg. Okay, B cells are located here, and the secondary lymphoid follicles contain activated B cells that have encountered an antigen. All right. So we said there's those pale centers in the secondary lymphoid follicles are also called germinal centers. So in the event of a bacterial infection, you have multiple germinal centers will be formed will expand and enlarge the lymph node, causing lymphadenopathy. Okay. For the paracortex, that's where your T cells are located. It will, in the presence of the viral infection, the paracortex will be expanded, leading to paracortical hyperplasia, and then your lymphadenopathy. Then the medulla has the medullary sinuses and the cords. The sinuses is where your macrophages are located. The cords have your B and T cells. Okay. So, and then talked about the George, which is a disorder that affects the development of the thymus, the disorder of the third and fourth pharyngeal pouches that will affect the development of the thymus, and the thymus is required for T cell maturation. So hence you have T cell dysfunction, and then the T cell dysfunction will mean the T cells cannot go to the paracortex of the lymph node. So those lymph nodes will be absent. The paracortex will be underdeveloped in those lymph nodes, and then the patients like that have recurrent infections and all sorts of problems. Okay, and then in other viral infections, you have expansion of the paracortex in paracortical hyperplasia. Okay, so there, so is there any is there any question so far?